Okay, so moving on, continuing with radiography, because what we're looking at are the actual airways, and because we have air in the air sacs and air in the lungs as a natural contrast media, we can actually see the lungs, especially on the lateral view on our radiographs. So when we're looking at all these little honeycombs on this lateral view, what you're looking at is the lung parenchyma itself. So this is normal, where if we look at all of the little honeycombs, they're all approximately the same diameter, and the amount of surface soft tissue around them is all pretty consistent. And if it looks consistent, then it's probably either normal, or the other thing is that it can be pulmonary edema. So what I have inset right here is a bird that has pulmonary edema, and all the little honeycomb areas are pretty consistent, but they just look diffusely thickened, because with edema, all the lung fields uniformly are going to fill up with fluid. So it still is going to look like all the little holes are the same size. The holes themselves are just going to be smaller. So you have a diffuse and regular enhancement of that honeycomb pattern with edema, versus pneumonia, where you're just going to have either patchy, just complete collapse of those spaces because you have little granulomas in there, or beginning with inflammation, you'll just have enhancement of that honeycomb pattern, often in a branching or tree-like manner that I'll try to demonstrate here. So this is a bird that has pneumonia, and if we look at all the little honeycombs once again, here, this all looks kind of normal. They're all about the same time. But then that whole honeycomb area, that pattern becomes just obscured. And if you think about the way that they develop, the type of pathology that you see in the lungs where they have little granulomas, those airways are just obliterated by little tiny abscesses, basically. So you lose that honeycomb pattern right there, and it tends to be patchy. It's very rare that you're going to have it all throughout the entire lung parenchyma, except in, end stage type of disease. So here in these beginning stages, we just have destruction of that honeycomb pattern. And normally you can't see the lungs very well on the VD view, but certainly if there are things like granulomas, like we have right there, then you'll be able to pick those out. And this is another example of pneumonia, and this was aspiration pneumonia in this fairly young bird that the owner was hand feeding. And from a distance here, we can see that this looks fairly normal, but then once again, we're losing that honeycomb pattern. And if we look really close up at it, here's where we had that sort of normal looking, and then you see almost like these little tree branching areas where the bird aspirated and it went right through the ostia, which is the biggest opening that goes into the caudal, thoracic, and abdominal air sacs. So, oops, it's not the right slide here, but this was actually the bird. So this is lung. So here's some normal lung right here, and we can see this green appearance because he actually aspirated some food that the owner was hand feeding. And so it has that kind of green appearance, and that's that lung field that we were seeing in that previous radiograph. And really, to get a sample of the lungs, as I said previously, you really can't do a tracheal wash. That's not going to be representative of anything past the bifurcation of the trachea. Really, the only way to get a sample is to go in there with an endoscope, and this is what you see if you go into the either the abdominal or the cranial thoracic, or excuse me, the caudal thoracic air sac. You are actually looking at the lung parenchyma itself, and you can get either even a biopsy there. You don't rely on negative pressure, so you can actually take a little lung biopsy in there, or just insert a swab through your working channel and just get a swab sample too. So treatment, if they're really dyspneic, you want to handle them minimally and then get them in oxygen right away. And then you really have to be very, very aggressive about your antimicrobial treatment. Hopefully you're catching them before they're dyspneic and they're just have that sick bird syndrome and they're fluffed up and lethargic, and you do your workup, and as part of that you're getting x-rays and you see that there's pneumonia beginning. You still want to treat it with a combination of oral antibiotics, or if they're hospitalized, parenteral antibiotics, and then locally, topically too, with nebulization. And if you can see in this little photograph here, here's our little cockatiel. Everything's steamed up. He's kind of looking out there through that steam. And owners can make these nebulizers at home just by buying these big Tupperware containers. And you can purchase nebulizers even on Amazon and just kind of hook it up. And there are lots of YouTube videos out there on how to hook up a little home nebulization chamber. We're going to nebulize with a combination of just saline to keep the airways moist, and then parenteral antibiotics based on your culture and susceptibility if you can. If you can't access the lungs, then just choosing something that's going to be broad spectrum, and just having them inhale that in addition to having the systemic. And if the lung destruction is severe and they're already dyspneic, then just talking to the owner about the most you're going to be able to do is kind of maintain them where they are right now and not expect a lot of improvement. So again, we want to try to catch that early. More often than pneumonia, you'll see air saculitis or infection in the air sacs. Most of the time that's going to be mycotic. It's a lot more common than bacterial, unless we're talking about chlamydia. Chlamydia does like the air sacs, so that's an area that we'll see chronic air saculitis, and sometimes bacterial, either with aspiration or as secondary to pneumonia too. So you can have a bacterial air saculitis, but again, it's going to be more common that it'll be mycotic. So air saculitis is actually more common because remember when we talked about the whole pathway of their breathing cycle, air is going to move through the trachea, and at least half of that air is not going to go through the lungs at all for any type of gas exchange, but instead move through the ostium, which is like the opening through the lungs that goes directly into the air sacs, move through either of these ostium into the abdominal air sac or into the caudal thoracic air sac. So you have direct from the environment without any filter at all going into these two air sacs. And the air sacs are warm and they're moist, and in their normal undiseased state, there's minimal blood supply. So it's just this perfect environment for the growth of fungus in particular, and the one we see most often is going to be Aspergillus, and it just loves to grow in air sacs. So normally, if you have a healthy bird and you're doing a necropsy and you look at the air sac, they're going to be pretty much crystal clear, you know, maybe a little bit foggy looking, just really depending on the species of the bird to some degree, but they're clear and they're thin. And that's why we're not seeing them on a normal radiograph, because there's really nothing to see. But when they become diseased, just like the cornea, you'll get neovascularization of that air sac. So you do have infiltration of blood supply into the air sac, and with chronic disease, it'll start to thicken. So this is actually a piece of air sac that came from a bird that has fungal infection. It just looks like bread mold on there, right? So it can become pretty extensive, and at that point, it'll start to thicken. And when it thickens, you'll be able to see it radiographically. So it'll start out more with this neovascularization and little fungal colonies, and then the sacs will start to thicken. And if it's mycotic, it will eventually just completely become encased in fungal lesions, and it becomes white and immovable. So this is the pericardium that we're looking at here, just to orient you. And here's our liver. And this is an air sac right here that is just completely lined with Aspergillus. And here is kind of a whole bird picture. Here's our heart. He has a little pericardial fusion right there. Here's our liver. Here's the gizzard, here are loops of intestine, and these are the air sacs right there, just completely thickened and covered in aspergillus. So the clinical signs, are we going to see dyspnea with diverticulitis? Most of the time, no. Again, it's going to be like pneumonia, that you just have that sick bird syndrome, fluffed up, poor feathers, losing weight, doesn't feel good, and really nothing to point at, which is why we end up needing to get blood work and radiographs and really kind of dig deep as to what's causing this bird to have these very nonspecific signs. And going back to that air sac, this is a really severe case of aspergillus, but that air sac is still flexible and it can still move and it can still push air in and out. So until they become rigid and stiff because they're completely covered with aspergillus, you're not going to see dyspnea as a clinical sign of air saculitis. You're just going to get those non-specific signs. And then on radiographs, that usually is going to be helpful. Sometimes in the beginning it can be kind of subtle, but initially the air sacs themselves are going to be just very, very thin, like a piece of plastic wrap. They're crystal clear, so you don't see anything. Basically, they're just providing the contrast, the reason why you can see all these organs. But as they become thickened, you can start to see the outlines of the actual air sac. So here's a bird with pretty severe air saculitis, and I started with this pretty severe one, so you get an idea of what I'm talking about with these air sac lines. And one thing really to note, when I'm going through radiographs, the first thing I do when I hit the coelom is to identify where is the proventriculus and is it making that 45-degree angle with the spine. And as we move there, well, we can't find the proventriculus. I mean, it just appears to be gone. And the reason for that is that you no longer have the air sacs providing that natural contrast between soft tissue and air. So there's nothing to give us any contrast, so you can't even find the proventriculus. So right away, instead of thinking, what's wrong with the proventriculus, just think, why don't I have that air contrast? And oh, because there's something wrong with our air sacs there. And this is a little more mild case, so I put up the more severe first, just so you kind of get an idea. We can see our proventriculus there, right, going down into our ventriculus, but then we have this kind of funny line right here. So you can actually see the division between the two air sacs, and here it's a little bit more severe. We can still kind of find our proventriculus, but here's one division between air sacs. There's another, these are just kind of granulomas up in there, but you can actually see those air sac lines. And then as disease progresses, and this is always going to be aspergillus, there's nothing else that can do this, completely coat the air sacs like this other than aspergillus. You know, can't find the GI tract at all because we no longer have air sacs, air in the air sacs giving us our contrast. And you can kind of see where all those air sac lines are. Here we're getting even worse. This was the same bird actually, where just the air sacs are completely filled up. And likewise on the VD view, normally you're just going to see that figure 8 of the organs and then air with really no delineation between air sacs. And in this case with severe air saculitis, you're not only going to see the lines, but accumulation of granulomas in there. So for the definitive diagnosis, again, really the only way to get that is going to be through endoscopy, to actually go in there physically with an endoscope and get a sample for culture and for histopathology. So treatment of air saculitis, again, we want to hit it both systemically with our oral medications and then topically. And the way to get topical treatment to the air sacs is to nebulize them. So here's our little budgie sitting in his nebulization chamber being treated for air saculitis. Okay, so I will record the next one and have it up earlier this week. And sorry, had to break that up into 2. You probably didn't mind. And we'll see you in a couple days.